Hi, I'm sending you this video to go over some low-tech rehab that you can do at home that oftentimes has a real huge impact on people's low back, the symptoms you're having. So before I go over the actual rehab itself, I want to spend just a couple minutes to go over the very general anatomy of the spine, which will help you understand what you're trying to accomplish. So here's a spine. It's a model taken from an impression of a real spine. Now, if this were a real person, this is the back of the head, okay? And we turn the spine this way. If this were a real person, their face would be here looking at you, looking at the camera right now, okay? Now, what you should notice here is that looking straight at this spine, the spine should be straight, okay? Now, if this person turned sideways, like this, like I am right now, what you hopefully can notice here is that the spine has three curves to it, okay? We have a curve here in the low back, or the lumbar spine, okay? We have another curve here in the thoracic spine. And then thirdly, in the neck, we have yet another curve going like this. So this curve here is called a lordosis, and you'll notice it should reasonably match here, which in the low back, and this is, again, a lordosis. And then this curve here, which goes exactly opposite the neck and low back, this is called a kyphosis. So you notice the older people, you might see them with a hunchback. That's where they're getting an increased kyphosis here. Now, the video that you're watching right now is concerned with the low back. What we see often, what I see on a daily basis, is people should be straight when we look at you this way. But when we turn sideways, there should be a curve here. But what I often see is very little, if any, curve here in the low back, meaning it's straight, okay? Where you should have this curve, it's flat, okay? Incidentally, in the cars, a lot of cars today, they have a lumbar support. This is the lumbar area. And you have a lumbar support that is meant to push this in. And that doesn't have as much curve, so we're going to, okay. So, when the spine is too straight, what it does is make it less resilient, and the spine has less endurance in daily life. So this is how I would like to express this. If my finger, let's use this one here, no, I'll go back to this one, represents this curve right in here. See the curve of my finger? Okay, so as we're walking down the street, we're creating an impact on our spine. And if we have a curve in our spine, as we have the impact, the spine, if you see my finger, okay, is able to bend. My finger is bending right now, representing walking or jumping or various activities, okay, just let's say walking. And the spine is able to bend ever so slightly and disperse those energies. And that's the way the spine is meant to function. Now, if your back in this position, in the side position, is straight, like my finger is right now, if it's going straight up and down right here, then if we again use the example of walking, then when you walk, okay, my finger doesn't bend. Now, if you were here, if you watching this video were here with me right now, and you put your finger up and I do this for 5 minutes, somebody's going to be real unhappy because your finger is going to start hurting in probably about 30 seconds because it's not able to disperse the energy, okay, through the joints, okay? So, sometimes I'll get x-rays back. Well, let me restate that. On a daily basis, I get x-rays back from a medical radiologist. And they'll say that the x-ray is a normal x-ray even when the spine is straight here. The reason, unfortunately, that they state that is they're not concerned very much, if at all, with the biomechanics of the spine. Research is definitive. It's very precise in stating that you should have this curve. So it's unfortunate that I get these radiology reports back on a daily basis, and they say that the spine is normal in terms of its curve or lack thereof. Okay, now I'm going to try to turn to what we want to do to help you, what you can do for yourself to help yourself and oftentimes have very profound impact on your particular situation. So this is a very inexpensive. It takes you just a few minutes a night, Monday through Friday, and you will do this while you are in bed. Okay? So, hopefully you're oriented again with the spine. If this person were real, they would be looking at you right now. Now this person is turning sideways and they're looking that way. Now, the rehab that you will want to do is lay on your back, okay? And then you're going to take a roll. This is a towel. This is a bath towel with 2 rubber bands holding it up, okay? Now, this I'm using for demonstration purposes. This towel, it's a full-size bath towel. It's wrapped up pretty tightly. It's a little bit on the big side, okay? So it should not be larger than this, okay? Now, what you're going to do is you're going to lay on your back. You're going to put the roll underneath your back, and you're going to lay there. And for how long? Believe me when I say start off with no more than a minute to a minute and a half. While the first time you do that, most patients give me the feedback that, oh, this is fine, I can stay here for longer. But it's the next day you find out that if you do it too long initially, the next day you're going to be very, very sore. You're going to be aching, possibly down the legs, and you're not going to be a happy camper. So, again, I cannot emphasize enough when you first do this, a minute and a half at the most. A minute would be more optimal. And then, if you feel okay the next day, that is suggestive that you can start to gradually increase the time. Okay, so let's say you started a minute, and the next day you feel absolutely fine, no achiness, no tenderness, no new symptoms whatsoever, then you can increase it by 30 seconds. But be careful. This is an incredible rehab that you can do for yourself to increase this curve here in your low back. But you need to do it nice and slow. These things will take, done properly, you can start feeling results within some change, possibly in about 2 weeks. But this is a long-term rehab that you'll want to do Monday through Friday, laying on your back for a couple minutes. Once you get used to it, do it for a couple minutes, and eventually, once you establish that you don't ache or hurt the day after, you can start increasing to the point you can do it for 5, 10, 15 minutes. Some patients come back, they say they fall asleep with the roll underneath you. And as long as you can tolerate that, that's absolutely fine. Now, where do we place the roll? This is critical. Logically speaking, you will want to put it right around, for a man, right around where the belt is. Okay, it's wrong. If you put it where the belt is, that's wrong. You want to notice where my belt is. You'll want to bring it up 3-4 inches. Again, this depends on how tall you are. It'll vary, but you want to bring it up several inches where it feels like, that feels like it's a little too high. That's where you want it to go. If we use this, the belt, my belt would be, see where my belt is on me, would be right about here. So you want the roll to be more, you want it to be more up in this area. So again, my belt right now would be right about coming across right here. And you want 3, 4, even 5 inches, 3 or 4 inches above that. Okay? I hope this is clear. So, the other thing I would like you to do is I'd like you to make your roll, and I'd like you to bring it in so I can see what it looks like. So I can make sure that it's the right diameter, it's tight enough, and then you can show me where you're placing it. You do this. I have seen people with back pain for decades, and we make these rolls. You start using them very slowly in the beginning, and it makes incredible positive changes in a relatively short period of time. Okay? Thank you very much.